I am Dr. Edward Lewis with Spinal Health and Nutrition. Today, we are going to discuss a very most common chronic cardiovascular condition called hypertension, also known as high blood pressure, aka the silent killer. Why is this disease a silent killer? Because many adults are walking around with this condition and don't even know about it until they get themselves checked out, or if they do not get themselves checked out by a doctor, eventually they're going to experience signs and symptoms, which will lead to heart attacks, strokes, and it can be very fatal. So, what is hypertension? What is high blood pressure? Hypertension is known as when there is an increased amount of force or pressure of blood forcing against the walls of the arterial arteries. Okay. So what is considered hypertension? Hypertension or high blood pressure is measured in millimeters of mercury. Of course, you will need a blood pressure monitor or blood pressure pump that will measure our high blood pressure or blood pressure actually. Whenever the number is 140/80, that is considered high blood pressure. We will want our blood pressure to be at least 120/80, which is normal. Anything that's above 180/80 is severe hypertension. And that is a cause for the emergency room. So what is the top number? The top number is known as the systolic pressure. That is the amount of pressure that is flowing in the arteries while the heart is beating. The bottom number is called the diastolic pressure. That is the amount of pressure flowing through the walls of the artery while the heart is at rest. So what is the cause of this condition? Number one, genetics. We have to know our family history. We have a family history of high blood pressure or hypertension. There's a huge possibility that we have it in our genes. Whenever this condition is genetically coded in our genes, our blood pressure has a tendency to go up whenever we consume something that has a lot of fat or sodium in it, especially when we find ourselves in stressful environments. Another cause of this condition is age. Do you know that as we get older, the elasticity of our arteries become less flexible, which will create an increase in resistance of blood flow? So we have to keep that in mind. Of course, our diet. If we consume a lot of processed foods, now whenever we buy something in the aisle at the grocery store that has a lot of processed foods, chips, candy, we must pay close attention to the nutrition facts. If the amount of sodium is above 5%, that is pretty high. We have to watch that, okay? Foods that are high in cholesterol. When cholesterol builds up in the walls of the artery, that prevents the arteries from dilating, which will increase the blood pressure, causing the heart to work harder. Our lifestyle. If we're not physically active, exercising, doing cardiovascular exercises, we sit around the couch all day, not doing anything at all, okay? We always find ourselves being stressed out, working in stressful environments, inflicting stress on ourselves. That can increase our blood pressure. And obesity can also do it. The more fat cells that we accumulate in the body, the more pressure it can put on the heart and also the blood vessels as well. I'm also going to talk about some simple, natural, and cost-effective ways to lower our blood pressure. One is the use of garlic. Now, many people don't like using garlic because of the smell, and they had to spend a lot of time in the kitchen cutting up the garlic to put it in their tea or put it in their smoothies. But I'm going to show you a simple product that we can purchase that will help lower our blood pressure. This product right here is called chaotic garlic. You can find it at any health food store or you can also find it on Amazon. It doesn't have that smell to it, okay? Now, the way this will lower the blood pressure is that it produces nitric oxide, which will help dilate the blood vessels so that the heart muscle can relax, and it will also lower the blood pressure. It also prevents a hormone or peptide called angiotensin 2. Angiotensin 2 causes vasoconstriction. It constricts or narrows the walls of the artery. So the garlic will prevent that from happening. So the blood vessels can dilate. Another thing we're gonna look into are beets. A lot of people don't like using beets because once again, they have to cut it up, put it in a smoothie, or make juice out of it. It takes a lot of time and effort in the kitchen doing that. We can also go on Amazon and purchase this product called Super Beets, okay? It comes in a powder form. All you need is to put 1 scoop of this product into 8 or 16 ounces of water. Super Beets also produces nitric oxide, which will help dilate the arteries as well. So there are some natural things we can consider to help reduce blood pressure. If you're on any blood pressure medications, please consult with your doctor before purchasing these products. Last but not least, we can also look into this product right here. This is called black seed bitters. Then this is a good product, especially if we have a combination of other stuff going on. Hypertension, diabetes, high cholesterol. This works on everything. Lots of benefits with this product. You can also find this at any local health food store, and once again, on Amazon. So the good news is, if we had this issue, there are some natural things out there that can help reduce this problem. It can be reversed, but we have to execute this issue as soon as possible before it's too late. Because once again, it is a silent killer, okay? We also have to stay active. We need at least 150 minutes of exercise each week, and that includes aerobic activities. Why did I mention aerobic activities? Because the heart is a muscle itself. It needs to be strengthened. So whenever we're doing some type of cardiovascular activities, that will help strengthen the heart muscle. The stronger the heart muscle, the more it can lower the blood pressure, okay? So we need at least 150 minutes or 30 minutes, 5 days a week of aerobic exercises. We have to reduce the sodium intake. I know I mentioned before in that diet, we have to watch the sodium. So how does sodium increase blood pressure? If you think about it, whenever there's sodium in the bloodstream, there's also more fluid or water, because sodium draws water to the bloodstream. So whenever there's more fluid in the bloodstream, the heart has to work harder, which will increase our blood pressure. And also the kidneys have to work harder to actually detoxify or flush out the excess amount of fluid. If the kidneys work too hard, the kidneys will eventually shut down. And we don't want that to happen, because that can lead to being on dialysis due to kidney failure. We have to reduce the amount of stress. In the times that we're living in, we are all in stressful environments. Stress, anxiety can definitely increase the blood pressure. It doesn't matter how good our diet is, how much we exercise. If we continue to stress ourselves out, that can increase the blood pressure, and that can lead to symptoms down the road, heart attacks and strokes, okay? Let's reduce the stress levels. Let's definitely get more sleep, okay? So let's attack this chronic condition. We have to take into consideration the issues that can happen down the road with this silent killer called hypertension. I am Dr. Lewis, and thank you for listening to our channel. Please subscribe and share this video. And remember, your health is your greatest investment.